I'm going to talk a little bit about concepts first, because I think it's important for us to understand the difference between what is a disease, and illness, and then what is sickness. A disease is a pathological process. So in this pandemic, the disease of COVID-19 is caused by a virus. The illness is how we experience it. As someone who perhaps catches the virus, you can become very sick physically. You can also experience very variable symptoms, including being asymptomatic. That means the virus attacks your body, but produces no conceivable perception of illness in yourself. And then, of course, there is the role that society ascribes to you, what I call sickness or sick role. And today, the sick role, if you have this virus, is you'll be isolated and quarantined. So these are different definitions. From a medical viewpoint, we often look at disease and disorders. Illness is from the perspective of the sufferer, the one who suffers from the illness or the disease that has a pathology. So it's important to recognize that. And of course, there's a definition that society wants to ascribe to certain illnesses. And of course, linked to that is stigma. So mental health is a stigmatizing scenario, a situation. People don't like to talk about it. Therefore, I wanted to talk about the concepts. So between mental health and mental illness. Firstly, mental illness. That's something that we talk about. It could be also mental disease or disorder. There is a state of no illness or a state of illness. Now, one good example is depression. Depression is a common mental illness. It is a syndrome. There are a specific classification of symptoms, and there's mild and moderate. Now, depending on which part of the world you go to, it could be about 20% of the population will develop mental illnesses like depression. In Singapore, it's probably a little less, 1 in 7 and not 1 in 5. But still, it's a proportion. Not everyone has a lifetime risk of developing a mental illness, which is a good thing. But can we predict who develops? The answer is no, not really. So some of us are more vulnerable. There are genetic factors. We, of course, don't have the time to talk about that. But it's important to recognize there is a illness here. Just like, do you develop cancer? What's the likelihood? There are risks, but we can't predict it very accurately. There are some ways for cancer. Not so sure we are very clear on mental illnesses, but there are also some risks. For example, if you had an adverse childhood experience, that could put you at risk of developing depression in later life. Now, on the other hand, mental health is quite a different thing. Mental health is more about stress. And when there's no stress, probably there are no problems. But very often life is stressful. And that will result in bad stress situations, distress, and problems. So example of the unhappiness that we feel. It could be, we could get upset, something happens, or we could become heartbroken. That is not necessarily mental illness. It's more about stress. The other piece that's important here is if I'm suffering from mental illness like depression, I may have no mental health problem, or I may have mental health problems. What do I mean by that? That depends on whether you're happy with your life. You can be suffering from depression, which is an illness that needs treatment. At the same time, you may be actually happy with a condition. You are able to relate to the people. You don't have much stress. You're able to manage. At the same time, you could be very unhappy with your life. These are two different things. They do not necessarily work on the same spectrum. And unfortunately, a lot of times when we talk about mental health, we tend to confuse the two. And that's why I'm trying to sort of set these two apart. The other piece that's important here is this concept of how stress relates to mental health. Let's talk a little bit about it. When there's distress, the brain's expected usual response to stress of daily lives can happen to each one of us, and then we get distress. All right, it can lead to, of course, some degree of coping and adaptation. Although it's negative, it can be helpful if you reframe it and see it as something that can make us stronger. Very often, mental health distress does not necessarily need treatment. You just need to learn to cope. And this is what we're talking about. Being mindful helps you to cope with stress better. On the other hand, mental health problems, the stress is probably a little bit more severe, a little bit more chronic, a little bit more long-term, and maybe quite intense, such that the person may have difficulty adapting to it. That's where additional help is helpful. Maybe a counselor, a therapist to talk you through this. Again, this is mental health problems. They do not need treatment in the medical sense. That means in the mental illness sense. This is mental health problems. Now, on the other hand, mental illness, though it can be related to stress, and stress could be in the longer term, be one of the causative agents. For example, it can create adverse childhood events that unleashes or unlocks your genetic risk for developing clinical depression. The brain has stopped functioning as per normal. It is a combination of genetic and environmental factors, can appear in about 20% or lower, depending on which part of the world you live in. And obviously the diagnosis and treatment needs to be evidence-based, needs to have professional help. And that's the difference between mental health and mental illness. Now, of course, a person can be in mental illness state and mental health state, depending. For example, a person with schizophrenia, this is a mental illness, but their mother has passed away. It's a mental health problem. They lost their school notes. That could be stress. And now they're hanging out with their friends and enjoying themselves. All these states are variable and they move and dynamically affect one another. Now, what about stress? What is stress? There's good stress, there's bad stress. So there is a sweet spot in which stress gets to maximum, in which there is optimum performance, beyond which it starts becoming bad. The individual loses control, it continues, stress continues for a very long time, and it causes extreme emotions and can interfere with life generally. If you look at this, the job functions that had the most stress were things like administrators and allied health professionals, and overall it was about 18%. What we did discover is that when there was burnout, the people who were most stressed not necessarily were the most burned out. So why is that so? It's because it was meaning in what they do. And I think this is some part that we need to be aware that stress in and of itself, whether it's chronic, short-term, acute, if the stress is around things that you enjoy, you can actually use it positively, and it's good stress versus bad stress. So this really burnout is kind of linked to bad stress. So we have to find out what are the factors that stress, apart from it being very chronic. Now, what about isolation? In this pandemic, one of the issues that we have is isolation. So this was a study done in China. It's the only one I could find. There are about 5 or 6 papers, but this was the only one that they systematically studied how many kids, as a result of isolation, had problems. And they said 67% of parents actually struggled with their children during the lockdown in China. And this is sort of early evidence that, in fact, some degree of isolation has impact. Well, the first is 21% of the kids, the young people, had this issue of fear and worries about infection. And this is a very real thing. I think in Singapore, we get to the stage where we're thinking there's not enough fear because people are, going out and socializing. But fear is an important factor that started with the isolation. Then missing friends, personal space being lost because people were living in their homes and they couldn't go out and they were interacting only with their family. There was boredom and frustration, and there was failure in school because home-based learning, though a good solution, at least from an infection control point of view, was not really good for schooling kids. So these were the 5 F's, you could put it, that was associated with isolation. Something to remember. Of course, this is now changing as we start to open up after our circuit breaker. Are there COVID-19 related mental illness? No, but this is published in April. 50 children have been infected, and so far we've not heard of mental health sequelae directly. I have heard from other countries. We had a seminar with our colleagues from Brazil and Korea, and in Korea they actually had some cases where there were psychotic symptoms associated possibly with inflammatory illness in the brain, but we're not sure. So we don't know about mental illness associated with COVID-19. What we do know here is that, and I saw that Ganesh had already shown you the sort of emotional epidemic. Before we talk about the emotional epidemic, I just wanted to say that the first step, that when Singapore started to work on this issue and trying to isolate and quarantine patients, and also having the lockdown or circuit breaker, was that if we didn't control that, our healthcare services here would have reached capacity. We never got to there because we actually created protective measures, the wearing of masks, the very stringent infection control that we did in the hospitals as well as in the country as a whole. So we flattened the curve. But having done that, we don't know whether our healthcare services capacity is being overwhelmed. Firstly, this is only in terms of general hospitals and ICUs. Mental health services are not quite as well resourced as our physical health services. And you've heard that there are two possibilities in this emotional epidemic of COVID-19. One is whether there are mental health issues associated with the fears and worries. Are there mental illnesses that become worsened as a result of, firstly, the fear and worry, and the fact that they don't get to treatment as they normally would. They would, don't have a chance to see their regular doctors, their psychiatrists, and so forth. And then post-pandemic, which we're nowhere there yet, certainly, the recession and the mental health issues around this. And I think this is where the point that Dr. Ganesh made about suicide, I think is important. Well, suicide, a lot of people think it's a mental illness. It's not. Suicide is usually related to mental health issue. Only up to 50% of suicides has some mental illness link. 50% of suicides don't. They are mental health related. That means they are distress or problems that are related to bad stress. Bad stress leads to suicide. And so that part is important. For mental illnesses, there's a greater chance of post-traumatic stress disorder. I mean, the number of studies have demonstrated that PTSD is on the rise during the pandemic, particularly around healthcare workers. Now, so we don't know the general population, but there's that risk. You are exposed, or you meet someone who's had the illness, you're quarantined. These could result in PTSD. And then, of course, potentially some existing patients, because they don't get sufficient treatment, continue to have problems. So mental illnesses can be there. But I'm more concerned about the mental health issues, because that would be to the greater population and to the children. In this sense, these two things, the family in Singapore under some degree of stress. All right, this is an old picture of parents queuing up for bringing their children for smallpox vaccination. But have we had any stress vaccination? Well, there's this thing about social isolation, about school and whether they could go back. What about kids with special needs? What about doing things at home with a family? We hear about seniors turning to tech. This is actually a great stress for the seniors. A lot of useful articles, but I noticed that a lot of seniors struggle with technology. And then what happens to parents? Will there be monsters as a result of all of this? So mental health must not be ignored. I think that's the final message. But what can parents do? Well, I think they need to, first of all, stop fear and anxiety as much as they can. How do you do that? Don't give too much information to young children. Don't exaggerate the descriptions. Of course, the stories in the newspaper can be, the last few weeks we've had a lot of very scary stories about deaths and young children keep reading this and hearing this, they become scared. And of course, certain degree of uncertainty in adults in particular, or adult distress will make children even more distressed. So that's important to bear in mind. So parents need to be calm and supportive, provide clear, accurate information about, for example, infection control measures, washing your hands, social distancing, but how can you continue to stay connected? Be age appropriate, but also be honest. Have plans for the family, and this is where I'm going to focus. What parents can do during this pandemic is about the family. That's the most important thing. So what is a family? Well, the family is the basic unit of society. You'll see from now on a couple of pictures about my family. This is in happier times when my mom was still alive. And it does mean that a family is the basic unit, and that children need the family to raise them, not just the immediate family, but the greater extended family. How does this pandemic impact our family? Well, let's talk a little bit about how parents interact with children first. First is what I call parenting styles. It is important that parents employ parenting styles that are consistent with one another, but each one of us has different ways. I like to think of them in two main domains. One in terms of responsiveness. How responsive are you to the child? And the other in terms of demandingness. So some parents are very responsive. They're very warm and nurturing and loving. And some parents are very demanding. Now, you can have different grades of each one of them. If you're low demanding and low responsive, you're not fit to be a parent. And that's very rare, okay? You give nothing to the child, you're abusive. That's rare. Neglectful and abusive parenting. High responsive parents with low demand, quite common, but not entirely good, because you're very permissive. You indulge, you give in to the child a lot. What we'd like to see a little bit more of is perhaps a high demanding parent who may be low responsive. This is quite common in Asia. Low responsive in terms of typical way of describing parenting. That means they don't always show their love and say that they love their kids and so forth. This is changing. A lot of young parents, I don't see them like this. I see them this way. They are highly responsive and highly demanding. And this is the most common form of parenting that we see. This, of course, is the ideal. Some of us are like that. Is this bad? Not necessarily. I put green on both of these, because authoritarian parenting is does work in Asia, but you need to allow the child to understand that you do care about them. And how do you do that if you can't use words? There are other ways of showing of responding to the child. And you need to find those ways that work for you, because not all of us are good with words. The other part about parenting is the relationship. Apart from child rearing practices, a lot of us focus on this when we talk about parenting. What's a method of parenting, which is what we talked about, right? Authoritarian, authoritative, but there's also relationships involved. First, understanding the child and his temperament, because that's the personal characteristic of some children. Some children are really easygoing. Doesn't matter how you are as a parent, you'll be fine, okay? Because they are quite resilient. There are parents, but some children are not like that. Then the parents and their relationship with each other is quite important, because parent is not one person. I mean, there are single parents today, but generally parents work with one another. And if you cannot work well, you have to. So please understand that the relationships, both between yourself and your child and you, and of course children also have siblings. If they do have siblings, their relationships also have impact on this parenting process. The other thing I wanted to sort of focus a little bit about is this overwhelming emphasis on how expensive it is to raise children. It is because Singapore is such a financially, fiscally responsible nation. We always think about money. And in fact, Smart Parents magazine at one stage says that every child you raise, you need $670,000 from getting them to finish, their higher education. And that is patently untrue, because I've got 5 children. I don't think I spent a couple of $1 million on each one out there. And so the reality actually is, when we ask the kids, they don't talk about a lot of money. They do want to get good results. But one of their wishes was that mom doesn't act. But what I thought was important, number 3, is having a happy family. And that's important to kids. So that kind of thing, no amount of money can buy. What's our future family like in Singapore? It's actually rapidly shrinking in terms of number of children that people have. And I usually try to encourage people to have children because, like I said, firstly, it doesn't cost a lot. What you need to give them is a happy family. But then those are things that money cannot buy. So maybe it's easier to have less children, because you have money, all you have is money, then you can't have a lot of kids. But this is the reality in Singapore. The fertility rate is dropping. A young child is really having to look after a lot of people ahead of them. And the other problem And I talk about this largely because this is a real issue in Singapore, and during this pandemic, because of that close proximity. I know in China the divorce rates went up. Our divorce rates are kind of creeping up. It's not great, but how does divorce affect the family? Well, one painting here you can see is this is how a child whose parents are divorced sees the family. Where's the father? Well, they could see the father, but there's a line in between the father and the, you know, and here's another depiction. Bye-bye to the family. Is divorce the end of the family? I hope not. I mean, I've been reading quite encouraging stories about how the courts are trying to manage divorce. But divorce has impact because, you know, when parents don't love each other, they affect. And sometimes they also involve the children in conflict. And that has a mental health impact, you know, going in the courts. This is a child who drew a picture of the hate, sadness, and love that she feels in her heart. So families are affected by this. So I'm going to talk about 3 things that you can do to try and keep things simple. The first is relationships. During this pandemic, it is important to have a good relationship. I put this term here, serve and return, because this is a term that the Harvard School of the Developing Mind actually talks about how the baby in the first 1,000 days of life requires that interaction with an adult, a loving interaction that produces the right neural connections that will bear good fruits in the future. So it is so important. You need to spend time with your children. People talk about quality time. I talk about quantity, because you can't have quality time without time. And time is just time. You just have to spend time. If you have young children, you need to think about spending time with them and have at least one important caregiving adult with your child. You need to provide respect in relationships. When I say respect, it really helps in your relationship with your child that you respect them as individuals. You give them an ability to sort of say, this is their views. Of course, if your child is very young, that respect has to be tempered by what is reasonable and also what's logical, because they may not be rational at a younger age. And that's why an authoritarian parenting technique is not a bad technique. It's just that it needs to be held in the right time. Have trust and understanding, communicate, and that process should evolve over time. So the relationship is not static, it's dynamic. It keeps changing as the child is growing. So these are my kids, right? When they were kids and when they're older. Yesterday, the daughter on the left of this picture, got married. It's a very different relationship than when I first started with her when she was a little baby up there. So you must understand these relationships will evolve over time. The other thing is you must create routines that have rules that are reasonable. And rules are nothing if there are no punishment and rewards for the rules. As you understand, if there's a law and nobody keeps to the law and there's no result and consequence of that law, it makes no sense. So if you have rules, you must have punishments and rewards. And how do you do that? Well, a very simple way. If you want behavior to increase, and you've got a rule about particular behavior that's good, then you need to introduce what I call likes. Likes are rewards. There are ways of removing dislikes, which is another form of reward, is take away things that the child doesn't like. You can decrease behavior. So increasing behavior is only with rewards. You can't use rewards to decrease behavior. Decrease behaviors, you have to use punishments. You either introduce things the child dislikes, or you remove things that the child likes. I say this very simply because I don't have time to go into this whole operant conditioning technique, but it works not just for children, but for your spouses as well. So it is important. Finally, role models. All right, it is important to have role models. And how do you have these role models? Either in the positive stories that we tell, in social learning, modeling adults and caregivers, it's important. And if you have, if you have more than one child, it's excellent because they can help each other, improve their self-awareness. And this is where the mindfulness piece comes in. And of course, volunteer work. Why is volunteer work useful? Because it tells people that people matter, their lives matter. And helping others in need will help the child develop a good sense of self-esteem. So these are the 3 things I expect you to think about as parents: relationships, routines with rules, and role models. So finally, just a very simple summary. and I know I'm running out of time, is to remember this mnemonic here during this pandemic. Okay, it can be found on the ACAPAP website, the International Association of Child and Adolescent Psychiatry and Allied Professions. Reassure the children, empower them to make decisions, help them along, maintain your own calm because you have to look after yourself before you can look after them, engage them in activities so that they don't feel like they're frustrated and bored, manage their emotions, especially the fear and anxiety, reduce it by not being too hyper-realistic, and beware the media and its impact and the horror stories that they can tell. Educate them about the pandemic and help them to understand what it means to have a virus. It's not the end of the world. You can still have routines. Try and normalize life. So remember a simple mnemonic. Just a final piece about raising good children. If only we could put them in a pot and just add water. It's not so simple. So thank you very much. And some pictures of my kids. They're no longer kids, but happy to take questions subsequently. Thank you.